meeting of the committee will come back to order. The chair would recognize himself on the Pallone amendment. Mr. Pallone, your amendment deals with a wide range of health issues, ranging from school-based immunization programs to emergency and trauma care. I know it represents the work of a number of members who have championed these causes, and you have decided to take all of those proposals, which, in my opinion, really shouldn't be all that controversial because they involve reasonable public health matters that we hope will prevent diseases and allow us to hold down health care causes, not to treat those diseases that could be prevented. The amendment has what's called the Class Act. Could you tell us what the Class Act is? It's a great name.
It's a classy act, Mr. Chairman. No, I'm kidding. I'm sorry. Basically, what this is that people who, now have to get health services, chronically ill people, people with disabilities, who now have to get services through institutionalization, there would be a hospital, nursing home, whatever, would be able to pay into a system, a voluntary, payroll deduction, and after a certain number of years, if their health becomes endangered, they get a chronic illness, or they become disabled, they would be able to tap that, so they'd be able to get those services that normally would be provided by a hospital or nursing home in a community setting. So it's a way of, having people finance over their life, if you will, so that when they get on.
This would help people for long-term.
It's a long-term care system for people with a voluntary checkoff, so that it's paid for, through their payroll. There's no cost to the, to the government because it's.
But it helps people who voluntarily pay into this fund to be able to use that fund.
Right, and this is a major issue, Mr. Chairman, with the disabilities community that approached me about this many times. I think they approached Mr. Dingle. Sometimes they get very aggressive about it, needless to say. And and it's also something that Mr. Kennedy has sponsored in the Senate, and that's in the HELP bill. Not that I want to mention the Senate, God forbid, but
Well, it is an issue that Senator Kennedy has championed, and it's very much wanted and needed. There are other provisions in the bill. They seem unrelated, but they all have in common provisions that you and the staff felt were worked out and not that controversial. The manual labeling, for example, is something that's now been agreed to by all the stakeholders, that's S-T-A-K-E, stakeholders, restaurants and consumer groups and others, so that people can get information when they eat in a restaurant. There's emergency and trauma care provisions, school-based immunizations, telehealth reauthorization, which is playing more and more of a role in giving people the ability to have assistance from healthcare providers, not in front of them, but who can evaluate the medical situation and advise patients and their healthcare providers. The pain care and management. There is a Federal Torts Claim Act for CHC volunteers. Is this to allow, as I understand it, those people who volunteer at a community health center to be put under the same provisions as employees at a community health center? They would be covered by the Federal Torts Claim Law, so they wouldn't be barred from volunteering and be required to get a medical malpractice health care and coverage for their volunteer period. I strongly support your amendment. It has a lot of good features in it, and I would hope that members have had a chance to look at the amendment and would feel likewise. I want to recognize the gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. I want to ask the author of the amendment, Mr. Pallone, going to page 7 of his amendment, subtitle H, Nurse Managed Health Centers. I've had to read pretty quickly through this. I didn't see anything in there regarding medical doctor supervision in any way, shape, or form in regard to these nurse-managed health centers. Could you give a little bit more explanation about that? Is there any physician supervision over these centers, or am I correct in assuming that this is just albeit well-trained advanced practice nurses pretty much practicing medicine at these centers free and independent of any other supervision?
I'm going to defer to Ms. Kapp since it was her bill.
I appreciate the interest in this. The advanced practice in the areas where there are nurse-managed clinics, there are provisions within the state regulations that advanced practice nurses have the ability to supervise and to carry out those kinds of decisions that are made there in primary care.
The gentleman will yield to me again so I can ask a question.
I yield to the
young lady from California.
I yield to the gentleman.
And I thank the gentleman, and I appreciate Ms. Kapp's comments on that. I don't know what the law is in California, but I'm sure it varies from state to state.
Yes, it would.
In regard to that, would this provision, Mr. Pallone and Ms. Kapps, would this provision be a federal preemption of all of the state laws regarding?
No, of course not. It would be only, that's why it's set up the way it is, as a voluntary or applicable in areas where these kind of provisions can be made.
Okay. And I thank the gentlelady, and I thank Mr. Pallone for that response.
I yield back, Mr. Chairman.
I yield.
Mr. Deal, you wish to be recognized.
Yes, Mr. Chairman, thank you. As I look over this 75-page amendment, I think I have counted as many as 13 separate pieces of legislation, which I think all of them have in one form or another been introduced as separate pieces of legislation. Now, some of these I feel very strongly in support of. In fact, am a co-sponsor of some of the individual pieces of legislation that comprise this amendment. Some I have reservations about. I was glad to hear the chairman say that everybody that fell under the menu labeling had already come to agreement. I was under the impression after reading it that the only way you could get out from under it was to have a blue plate special that didn't last longer than 30 days or 60 days, and that was the only way you were going to be able to escape the provisions. But maybe those who would be affected by it have looked at it more carefully than I have. But I have a procedural question of the chairman. Mr. Chairman, as I understand it, this amendment, the Pallone Amendment, is a second-degree amendment and therefore would not be subject to an amendment to it in order to extract portions of it that might otherwise be considered objectionable. Am I correct that this amendment is not subject to being amended?
Gentleman is correct.
All right. Well, I appreciate the response, and I personally would have preferred, and even though it may have taken a little more time, for us to be able to deal with these individual pieces of legislation separately so that people could express their opinions on them individually rather than collectively. But I appreciate the gentleman putting forward many of these proposals that are encompassed within this amendment, and I yield back my time. Thank you.
Let me, if the gentleman from Georgia, Mr. Deal, if you want to divide the question on these different parts of the amendment, I think that would be an appropriate request. Do you want to take out something for separate consideration?
Mr. Chairman, I've heard expressions from some of our members of perhaps an indication that they would prefer to do that. I'm afraid time-wise we haven't had a chance to get a collective judgment on that at this point.
I see. Okay. Well, the amendment, as it was proposed, is...
I would, Mr. Chairman, in light of your apparent offering on that, I would like to request that the menu labeling portion of the amendment be separated out for a separate vote.
Okay. Without objection, we'll put the unanimous consent that the section of the amendment dealing with menu labeling be put aside, and the amendment without that will be under consideration. Hearing no objection, that'll be the order. Are we ready to vote?
Mr. Chairman.
Yes, gentleman from Oregon.
Thank you, Mr. Chairman. I'm just now being able to peruse this amendment, which came out at 9:09 last night, it shows here. Are there any, has this been scored, or do we know how much money we're talking about here? Do you know, Mr. Chairman? Are there any data on the costs of this?
Gentlemen, we yield. These
Yes,
are authorizations of appropriations.
Right.
So we don't have a score on authorizations. The score would be on the appropriations.
So is there like a grand total for the amount that we're authorizing here?
Let me ask counsel if there's a grand total for the amount. Could speak.
Are there totals for each bill? Perhaps I could direct to the council then, Mr. Chair. Could you show me on what page for each of these? I understand there are 18.
No, if you yield to me, often authorizations spell out a specific amount. Oftentimes authorizations leave it to the Appropriations Committee to figure how much is needed after they examine the request. But we would authorize a program, and then the Appropriations Committee would make those decisions.
And I appreciate that, Mr. Chairman. I also know that oftentimes the Congress is held accountable for not fully funding what's been authorized. Clearly, that was the case in the No Child Left Behind legislation. For many years, there were arguments made that a large sum was authorized and then it was never fully funded. So, counsel, can you direct me to where the authorizations are in this bill, in this 75-page amendment? Your mics, I'm sorry,
Put your mic
sir.
on.
I'm quickly scanning. All of these are authorizations of appropriations for discretionary spending. So far in my quick scan, the only specific number authorized is on page 24.
Page 24 is the only place that you found?
So far, that's all I've been, pardon?
Okay.
And again, on page 24, there's $10 million authorized for telemedicine incentive grants. And then again on page 35, there's $100 million authorized.
Well, now on page on 24 it says $10 million for fiscal year 2010 and such sums as may be necessary for each of the fiscal years 2011 through 2014. So that's an open-ended authorization?
Yes, sir. There are many programs in the Public Health Service Act that are authorized at such sums as may be necessary.
I see. Are there other specific authorizations?
On page 48.
Page, if I may, page 35, line 4, there are authorized appropriations.
And that's $100 million?
That's $100 million.
For 2010, and then it's open-ended after that?
Followed by such sums as may be necessary.
Okay, thank you.
I am page 44. They're authorized $12 million.
And then such sums as may be necessary?
No, sir.
Oh, that's for each fiscal
year.
Wow.
And then again on page 48, $500,000 for each of 2 fiscal years, page 48, line 11. And again on page 56, lines 19 and 20.
Right.
$2 million for fiscal 2010 and $4 million for each of fiscal 2011 and 2012. Page 59, there again such sums as may be necessary, no specified total on line 9 of page 59. On page 65, such sums as may be necessary. And finally, on page 75, for the extension of the Wise Woman program for preventive health screening for women, $70 million, 73.5, 77, 81, and 85 in succeeding years. Those are the totals. I'm sorry, sir, I do not have the current appropriations levels for those programs.
Mr. Chairman, do we have the current appropriation levels somewhere for these programs? Just trying to get in perspective what's being authorized and
with all deference, sir, the the Labor HHS Appropriations Committee is meeting this morning to mark up theirs. I don't even know which staff people I would go to at this point to get the
But do you have it for last year, for the current fiscal year?
I could find it. I do not have it with me now.
We probably won't have time, I guess, so we don't really know. Okay. Thank you, Mr. Chairman. I realize my time's expired. Thank you.
Mr. Chairman. Any further discussion?
Mr. Chairman.
Mr. Chairman.
Let's see, anybody on the Democratic side? If not, we go to Mr. Barton again.
I'm going to yield some of my time to Mr. Booyer and Mr. Shaddy, but I'm going to insist on my point of order. I'm going to use the same rule and the same logic that Mr. Pallone used on Mr. Burgess's liability. In his long-term health care section, there is clearly an item on page 3, line 10, establish mechanisms for collecting and distributing payments. That is clearly jurisdictionally totally within the Ways and Means Committee. So if Dr. Burgess's liability language was not germane because of some jurisdictional totally within the Judiciary Committee, this section is not germane because it is totally within the jurisdiction of the Ways and Means Committee. So, you know, what's good for the goose is good for the gander, Mr. Chairman. And I would yield to Mr. Shadegg or Mr. Booyer because they have some concerns on the.
Would the gentleman yield to me?
Sure. Sure. I'll yield to Mr. Pallone before I yield to Mr. Shadegg.
Well, I just wanted to say very briefly that this was written specifically to avoid the problem that you're raising by saying that the program does not go into effect until and unless the Secretary sets up this, voluntary payroll deduction. So it's written to specifically avoid the jurisdiction of the Ways and Means Committee, and that's my understanding that that's with the language that we have.
We're claiming Dr. Burgess's amendment was written to give the HHS Secretary that same discretion, and it was ruled non-germane. I mean,
well, the gentleman yielded only briefly. It says specifically the program does not go into effect until a statute is passed that does that establishes the voluntarily payroll deduction. So we'd have to actually have legislation to accomplish that. That's how it avoids the problem that you're suggesting.
Okay. I'm going to yield to Mr. Shadegg.
I thank the gentleman for yielding. It was my intent to seek time on my own because I have a deep concern about the germaneness of this particular amendment. If you go to page 4, it talks about liability protections for volunteers or volunteer practitioners. As I understood Mr. Burgess's amendment, it dealt with the issue of liability. We were told that that was in the jurisdiction of the Judiciary Committee. I, quite frankly, have for years wanted to extend federal liability protections to surgeons working in emergency rooms performing procedures, or doctors performing procedures in emergency rooms compelled by EMTALA. And I assume that if we rule this is jurisdictional, that we can in fact have this amendment, that I certainly intend to offer amendments that deal with immunity. This is a clear grant of immunity to practitioners, and quite frankly, I probably on substance agree with it, but I don't and can't agree with a structure where a Republican amendment on liability is not germane, but a Democrat amendment on liability is germane. And with that, I'll yield back to the gentleman from Texas.
Yield to Mr. Booyer, if I have the time. I think I do.
I thank the gentleman for yielding. My only great concern is, Mr. Chairman, is that we remain consistent. The purpose of the chair is to be impartial in your rulings. Impartiality is one of the most important attributes of leadership. So you cannot be capricious or arbitrary in impartial rulings. So if in fact Dr. Burgess's amendment was ruled out of order, you can't now claim and say that this amendment is in order. So if you would like to, my suggestion, Mr. Chairman, is if you would like to make this amendment in order, then we should reconsider Dr. Burgess's amendment on medical malpractice reform. We can't pick and choose, and that is my great concern. The other, on the subject itself, with regard to the community assisted living servicings and support, is that the CBO has already spoken on this issue, that they've questioned whether it's actuarial sound over the long term and whether premiums will be insufficient to support the goals for which you're seeking to achieve. So I'm really bothered here at the moment that the chairman of the Health Subcommittee, at a markup whereby we were given a 1,018-page bill, then the first amendment out of the box is a 75-page amendment to us that could be a bill in and of itself. I'm bothered both on two grounds, Mr. Chairman, one on substance and the other on procedure. So I'll rest to the gentleman's point of order and ask that the chair be impartial in his ruling.
I yield back, Mr. Chairman.
The chair is ready to rule, but do you, gentleman from Georgia, wish to speak on the point of order?
Mr. Chairman.
Gentleman's recognized.
I did have a question in not pertaining to the ruling of the chair. I wanted to ask either the council or Mr. Pallone on page 74, this subtitle R, extension of the Wise Woman program. I'm not completely familiar with the Wise Woman program. I have some idea of what it's about, but could either one of you explain what that program does? It's a good little bit of money involved at $70 million in fiscal year 2010, 73.5, 77 million, all the way up to 85 million in 2014. So over a 5-year period, we're talking about a lot of money getting up in the
gentleman yield. Gentleman yield.
Of course.
I'll ask Ms. Capps. I know she wants to. Well, why don't I just yield to you if you like, Ms. Capps?
And I don't mean to preempt the discussion because other people know about the Wise Women program. CDC set this up as a pilot in 20 states, and it has been really remarkable in the way that older women have become aware of their prevalence toward heart disease, and that the steps that can be taken to recognize symptoms, to get to medical care. It actually helps to educate some of the providers that have not become aware, too, of the information that's available recently. It does some data collection. We just want to expand it to all states if they choose to incorporate it. It's already been approved. It's a part of CDC.
Will the gentlelady yield? Will the gentleman yield?
I'll yield to whom
I'll be glad to yield. I did have one question I wanted to ask the gentlelady.
The minority wants to stipulate that all women are wise. Let's just get that on the record. We don't want to debate about whether women are wise. All women are wise.
Reclaiming my time, if I have the time, that means not just the Supreme Court nominee, I'm sure, and I'm glad that you made that comment, Mr. Barton. I wanted to ask one simple question from the gentlewoman from California, from Ms. Capps. Is part of this program paying for cooking classes as well?
No, it's screening, actually. It provides screening for older women who aren't necessarily covered in any other way so that they can become aware of symptoms that they might have. It's a way to get women into treatment more quickly than to wait till some costly treatment is perhaps needed later.
Well, reclaiming, I mean...
Although nutrition education might be part of some of the outreach programs.
Further asking for yield of time.
Of course.
As you described the program, of course, it sounds good. I just think we could be spending a whole lot of money teaching cooking classes, and that was why I wanted to make sure.
Thank you. This has been verified to be effective in the pilot states in which it was initiated, and it's only based on the positive outcomes in those states that it is now being recommended by the CDC to be applicable to other states as well.
And I thank the gentlelady for yield.
We have before us a point of order.
Mr. Chairman.
And I'd like to deal with the point of order before we get into further discussion on the amendment itself. Anybody wish to be recognized on the point of order itself? The chair is ready to rule. The point of order has been asserted that this amendment is not germane for two reasons. Primarily that it passes a provision that would be in the jurisdiction of the Ways and Means Committee. On page 4, the effective date says that the Public Health Service Act provision, which is in our jurisdiction, shall take effect on the effective date of a statute establishing a voluntary payroll deduction under the Internal Revenue Code of 1986 to support the program authorized by such title. That had we legislated an effective statute of a payroll deduction, that would be outside the jurisdiction of our committee. What we do in this particular provision is establish the program, but the program, which is under the Public Health Service Act, would not take effect until the Ways and Means Committee establishes the tax. The second assertion of non-germaneness is that the community health centers provision giving liability protection would not be in our jurisdiction. This amendment to allow volunteers at the community health centers to be covered under the liability protections under this act is under the act in the public health programs. The community health centers are under the Public Health Act, and the parliamentarian in the past has always referred such bills dealing with anything pertaining to the health centers to us, including liability protection. So the chair would rule that the point of order is not sustained. I want to call for further discussion of the amendment before we proceed to a vote on the pending amendment.
Mr. Chairman.
Who seeks recognition?
Mr. Chairman. I won't take all my 5 minutes or whatever minutes we have, because I know most of the speakers on the other side are concerned about laying out a manager's amendment. And if the staff could explain to us, because it seems like being on this committee for a number of years, I remember this same thing happening, having a bill and then coming to the committee markup on a regular occasion, even when the majority was the Republicans, to have a huge manager's amendment laid out for our consideration. Is that not correct?
Would the gentleman yield on that point?
Be glad to yield, but I'd like the staff to remind me of previous times where we'd see a manager's amendment of X number of pages.
It is not unusual in this committee for there to be a manager's amendment of substantial size.
Thank you. And be glad to yield to my friend Joe.
I agree with it. I agree with what the council said. The difference is, at least when I was chairman, when we did manager's amendment, the manager's amendment was published, and both sides had a chance to look at it before we went to markup for a number of days. We never sprung, so to speak, a manager's amendment, and I don't remember ever having a manager's amendment in the nature of the substitute and then having the first majority amendment be, in essence, an addendum to the manager's amendment. I don't recall that ever.
Well, I seem like I remember 2003. Now, Joe, you weren't chair, but I also know this amendment was laid out last night at 10 o'clock, and my staff was able to look at it. And so, you know, let's argue about not the process, because I get calls all the time about you didn't read the bill, and I said that's our problem. But 233 years, I haven't been able to get Congress to read bills. And but if you want to complain about the process, that's one thing. But if you want to complain about the issues that are in the manager's amendment, that's separately. And we might move along quicker and at least be able to deal with it. And with that, Mr. Chairman, I'll yield, return my time to you if you'd like.
Just yield back your time.
Mr. Chairman. Thank you, Mr. Chairman. I have a question of Mr. Pallone. I don't see Mr. Rush here, but on page 57, subtitle O, Postpartum Depression, we have dealt with this issue in the two previous Congresses and adopted compromise language bipartisanly, sense of Congress language regarding a longitudinal study of relative mental health consequences for women of resolving a pregnancy, and in various ways that they may have resolved a pregnancy, including carrying the pregnancy to term, parenting the child, carrying the pregnancy to term, placing the child up for adoption, for miscarriage, for having abortion. So we had compromise legislation that included postpartum depression on the issue of abortion. I was just wondering why the compromise language that we passed in the two previous Congresses wasn't included. in this language. Could you? I think this is very important, because increased research on post-abortion depression would lead to greater awareness of the issue and the development of compassionate outreach and counseling programs to help post-abortive women. So I think it's important. I was just wondering if you can explain why that's not included.
Mr. Pitts, would you yield?
Yes, I'll yield.
We've actually brought up the same concerns, and you're right, we did have compromise language. It was Section 102 of the Sense of Congress regarding the longitudinal study of relative mental health consequences for women of resolving a pregnancy. With your acceptance, we're willing to put that language in to make sure that's clear. That was raised earlier, and we have it here, and we're willing to do it. Just didn't get it in time. So with your acceptance, so I need unanimous consent.
Section 102 language, yes.
Yes.
Yes, I would accept that.
Well, if it's appropriate, Mr. Chairman, I'd ask unanimous consent to.
Gentleman from Michigan seeks recognition for unanimous consent request. Would you state your unanimous consent request?
Mr. Chairman, I'd ask unanimous consent that Section 102, the sense of the Congress regarding longitudinal study of the relative mental health consequences for women of resolving a pregnancy, would be included in this manager's amendment in the appropriate section.
Is there any objection?
I'd like to reserve the right.
I recognize the woman from Colorado.
Mr. Chairman, I'm not going to object. I just would like to say that I think this compromise language is good, and I think we should look at the results. In the past, Mr. Stupak, Mr. Pitts, and I have all had disagreements on how we characterize some of these issues, but I think there can be mental health issues resulting from pregnancies, and I think this is good compromise language, and with that, I'll withdraw my reservation.
Mr. Chairman.
Yes.
One more time, and I'll shut up. Okay? We have operated on both sides in reasonably good faith on the health care issue. And you have been more than accommodating this week in requests I've made as to schedule. This particular amendment, in my opinion, is in very bad faith. It was posted on the G drive at 10:28 last night. Now, I don't know about other members. Apparently, Mr. Green's staff sits by the G drive all night long, and I want to commend him for that.
We want to make sure we read it all, Joe.
Well, I commend you, but I would suggest that you withdraw this amendment. There's some good things in it. There's obviously some good things in it, but it is a little unusual for the majority for their first amendment to be an omnibus amendment that was not readily accessible under normal conditions before the markup began.
Gentlemen, yield to me.
I'd be happy to yield.
If you feel so strongly about it, I think you make a case that you ought to have more time to look at it. So I'll join you in asking the gentleman from New Jersey to withdraw his amendment without prejudice, and that he be permitted to offer it again. Yes, we're withdrawing the whole omnibus amendment.
I would withdraw it at this time without reservation to bring it up.
And I would like to request that...
Parliamentary inquiry?
No, just a minute. I'd like to request that we be able to deal with this amendment before we leave today, if that is acceptable.
Well, that's better than... Sure. But
okay.
Parliamentary
we've
inquiry?
got a vote on. We've got a series of 13 votes at about 12:30. So we basically got 50 minutes before we end for the day, and because we're going to, these next series of votes are the last votes of the day, and they're going to take till 2 or 2:30. And by previous agreement, we'd agreed to end the markup today about 2 o'clock. So we're actually saying you've got about 45 minutes most. It'd be better to just pull this one off, bring it up first thing next week if you want to do that. But if you're bound and determined to have it voted on today, well, I can't stop you.
Parliamentary inquiry?
Who's seeking? Mr. Shadegg.
Thank you, Mr. Chairman.
State your parliamentary inquiry.
I'd just like to get a clarification of terms because I am trying to follow the ball game here. This, I understood, was the bill. This, I understood, was the manager's amendment. But we've been talking about, and Mr. Green referred to this as the manager's amendment. Is this the manager's amendment to the manager's amendment?
That is an amendment to the manager's amendment.
Amendment to the manager's amendment. So it's the amendment. It's the amendment by the chairman of the subcommittee to the manager's amendment.
That's correct.
I thought counsel was asked whether manager's amendments are common. I did not hear counsel asked if manager's amendments to manager's amendments are common. Maybe I should ask counsel that question.
The chair will announce on your parliamentary inquiry, if you find any rule that says this can't be done, please raise it. Otherwise, we have a request from Mr. Barton to withdraw the amendment. The gentleman from New Jersey has withdrawn it. I would take the recommendation of the gentleman from Texas that this be put over till next Monday, and we'll do that.
I was just trying to clarify things, Mr. Chairman. I was not objecting. I was simply trying to find out what we were talking about.
Okay. I hope the gentleman knows.
Mr. Chairman.
Who is seeking recognition?
Over here, Mr. Chairman, on our side.
Yes.
A parliamentary inquiry. What happened to the UC request regarding the Section 1 whatever language? Did that get adopted?
No.
Because it was pending, right?
It was pending.
So don't we have to take...
We put the whole thing aside. And I understand somebody wanted to look at that language as well to be sure it met the requirements. So the whole matter is put aside, including the separate issue in the Pallone Amendment dealing with restaurant labeling.
Thank you, Mr.
Chairman.
Now, gentlemen.
Parliamentary amendment, question. When Mr. Pallone reintroduces or brings the amendment back, is it my understanding, based on our colloquy, that it will include the Section 102 language that we have passed in the previous two Congresses?
Well, I would hope that could be worked out, but he'll be recognized to offer an amendment. He may offer a different amendment. He may offer it in a different way, but it seemed to me that we were pretty clear that there was going to be unanimous consent for that language that you had suggested.
Thank you, Mr. Chairman.
Would you want to complete the unanimous consent now? For that? Well, let's hold it for Monday. Let's don't get tied down. The Pallone amendment has been withdrawn. So we will go for another amendment at this time. Ms. Harmon, you have a recognition for an amendment that's at the desk?
Thank you, Mr. Chairman.
Well, let me ask you some questions. Is this amendment to Division C? Was it submitted within 2-hour lead time for review, and there are copies to be distributed?
Yes, it was, Mr. Chairman.
Okay, the clerk will report the Harmon
It's
amendment.
Harmon 36.
Wasn't it our turn?
Well, we drew his, so we ought to have a turn.
Okay.
Amendment offered by Ms. Harmon of California and Mr. Sarbanes of Maryland. At the end of Title V of Division C, add the following. Subtitle: Assisting veterans with military emergency medical training to become state licensed or certified emergency medical technicians, EMTs. Section blank. Assisting veterans with military emergency medical training to become state licensed or certified emergency medical technicians, EMT.
Mr. Chairman, I'd like to ask unanimous consent that the reading be dispensed with.
Without objection, the reading of the amendment will be dispensed with, and the gentlelady from California is recognized to explain it. And someone wants to reserve a point of order? Mr. Scalise reserves a point of order.
Okay. Thank you, Mr. Chairman. Mr. Chairman, this amendment was worked out with Mr. Sarbanes and your excellent staff, and also is part of legislation that I have offered with two colleagues, Stephanie Herseth-Sandlin and Melissa Bean. It would bolster the safety and security of our communities by enhancing the surge capacity of local medical facilities, and at the same time it would help returning veterans transition into civilian life. The amendment authorizes grant funding to create a fast track for military medics to become emergency responders. It also commissions a GAO study aimed at identifying obstacles keeping former military medical professionals from entering civilian medical fields. Mr. Chairman, everyone here understands the extraordinary service performed by military medics on the battlefields in Iraq and Afghanistan. They are the true MASH champions of our war efforts in those places, and they gain invaluable experience responding to IED attacks and other catastrophic emergencies on the battlefield. However, when they return home, the unemployment rate of returning vets is about 30%, and they have to start at the bottom getting training to become civilian EMTs. We think this makes no sense, and their experience should be embraced, and they should be fast-tracked for service that is absolutely critical in our local hospitals and other facilities. Many hospitals and emergency medical services throughout the country now operate at or near capacity, and obviously in the event of a terrorist attack, major natural disaster, or other mass casualty incident, the resulting surge of patients would overwhelm these facilities. Correcting this requires having the largest
Will the gentlelady yield?
Will the gentlelady yield to me before Mr. Barton, please?
Mr. Chairman, I would love to yield to my old friend, Mr. Booyer, first.
Because I have a sense on what Mr. Barton's going to do here. But here's what I'm going to ask of you, Jane. I think what you're doing here is right and it's noble. We've always had a real challenge trying to link the MOS of our soldiers to that what can be done in the real world. What I'd like to do with you, Ms. Harmon, is will you please withdraw this, work with me, let me go to my Veterans Affairs Committee, and also work with DOD. I think we can even make this better, and we bring this back on Monday. I didn't know about this, Ms. Harmon. I would love to do that. That's just my only request.
Reclaiming my time, Mr. Booyer, we
Yes.
did contact your staff specifically, given your experience in this area.
Yeah, I wasn't aware.
We received very positive reactions.
I said I liked it. Now that I read the amendment for the first time, and I just, what I want to do is shop it through the VAs. We have so many educational programs with the VA, and they're also working with DOD on what you're trying to do. Can I vet that?
Ms. Harmon, will you yield to me?
Yes, I will, Mr.
This is an amendment that I think Mr. Barton was going to accept. I certainly want to congratulate you and Mr. Sarbanes. I think it's a well-thought-through amendment. It doesn't preclude Mr. Booyer, as the ranking member of the Veterans Affairs Committee, from looking at further changes to it. But I don't want us to keep on taking up amendments and putting them aside. We got to close on some issues. And this one is so reasonable and so right that I would hope we just go forward with it.
And thank you, Mr. Chairman. Reclaiming my time, Mr. Booyer, I take your offer. I appreciate your good faith offer. However, we did work with a Veterans Committee member, Stephanie Herseth-Sandlin, on this, and we have been exploring how to solve this huge problem in the most effective way, and we have come to this proposal and worked with Mr. Sarbanes, and I'd like to yield to him for a minute, on a form of this that would fit well in the health care bill. And I do agree with the chairman that this is ready. And I would offer to you, after I yield to Mr. Sarbanes, to work with you on some additional initiatives we might take to help our returning vets. I'd like to yield to Mr. Sarbanes.
Further discussion of the amendment.
Mr. Chairman.
Mr. Barton, you saw recognition. Do you still?
Well, I did. I was going to say we were going to accept it, but I want to support Mr. Booyer. He's a former chairman of the Veterans Committee, so I personally think it's an acceptable amendment, but I yield to Congressman Booyer's judgment as the former chairman of the Veterans Committee. I personally do not oppose this amendment, but that's just me. I'm only speaking individually. I don't have the expertise that Chairman Booyer has.
Further recognition on the amendment. Mr. Sarbanes.
Thank you, Mr. Chairman. I want to thank the committee for working on this amendment. I want to thank Ms. Harmon as well. To put this in context, there's a significant set of provisions within the underlying bill that address the workforce shortages, and we've attempted in that respect to design pipelines that will produce more medical professionals over time. But there's also recognition that we need to do something in the immediate term, and the phrase I like to use to describe this kind of an initiative is rapid deployment. We have to see where we can rapidly deploy caregivers, even as we are developing these pipelines over time. Ms. Harmon is focused, I think, rightly on the tremendous potential in terms of the EMT profession to transition these returning veterans to that kind of work and to do it in a timely basis. I'm also attracted to another portion of this amendment which asks the GAO to conduct a study to look at other ways that we can, or other opportunities to transition returning veterans into other kinds of roles going forward. So this, on the one hand, is addressing the workforce shortage that we are very concerned about. On the other hand, it's providing a tremendous opportunity to our returning veterans, and it's in keeping with other initiatives that we've undertaken in this Congress already to focus on that particular issue. So again, I thank Ms. Harmon for her work on this. I would encourage everyone on the committee to support this amendment. I yield back my time.
Gentleman yields back the balance of his time. Mr. Boyer seeks recognition.
Mr. Chairman, and to Mr. Barton, Ms. Harmon, Mr. Sarbanes, let me speak specifically to your amendment. Number one, let me compliment you. You also are tying into exactly where the favored winds are. So I have no objections, Mr. Chairman, if you are willing to accept this amendment with the caveat that you allow me to vet this. Now the fact that you've also worked with Stephanie, but Mike Brink, 2 buildings away, is the expert. So let me over the weekend vet this. If it's good to go, that's wonderful. If not, the gentlelady, I've worked with you on many things over the years, and if there's some recommendations or any tweaks, we'll circle back to the committee, and I think that's the best way to...
Will you yield to me, Mr. Boyer?
Yes, ma'am.
So I think what you're suggesting is that we accept this amendment, assuming the committee is willing to do it, and
Yes.
if we can find some improvements
Yes.
In the next several days, we would have unanimous consent to add to this amendment to make it even better.
I believe that...
Is that what you're proposing?
That's what I'm proposing. I believe Chairman Waxman would be amenable to that, along with Mr. Barton.
Let me ask unanimous consent that should this amendment be adopted, the gentleman from Indiana, Mr. Boyer, would be permitted to offer a further amendment.
Perfecting amendment.
A perfecting amendment. Without objection, that'll be the order. Mr. Murphy?
Thank you, Mr. Chairman. Gentlelady from California, a colloquy, just a couple questions. Do we have a dollar value for what these grants would be?
No, we have not put that in.
My understanding is I read this does not bypass any certifications or licensing laws of any state?
No, we were careful about that, but it's to create a fast track. I mean, there are specifically demonstrated hardships for these trained medics who come back and have to start at the bottom, and a lot of the courses they have to take are way too basic for them, and yet they have to pay large registration fees, which means many of them are deterred from even becoming EMTs. This is a huge loss for our country and a loss for them.
So in other words, this would be a way that states could find out that they already went through the training and certification and do that. One other question then, are there any states who are already reviewing this? Are there any models out there already in existence that we might know of?
I understand that Kansas and Maryland are already doing this.
Oh, very good. I thank you so much, and I yield back my time, Mr. Chairman.
Anyone else seek recognition? If not, we'll proceed to a vote on the Harmon Amendment. All those in favor of the amendment say aye. Aye. Opposed, no. The ayes have it, and the amendment's agreed to. We're now looking to the Republican side for purposes of an amendment. Mr. Sullivan, you have an amendment that's been out for 2 hours. There are copies at the desk, and it's to this title?
Yes, sir.
Mr. Chairman, I reserve a point of order.
Gentlelady from Colorado reserves a point of order. The amendment qualifies. The clerk will report the amendment.
Amendment offered by Mr. Sullivan of Oklahoma. At the end of Title V of Division C, add the following. Subtitle
Without
F.
objection, the amendment will be considered as read. And
Mr. Chairman, I'd seek to reserve a point of order on the amendment.
We already have, so there are 2 reservations of points of order. Mr. Sullivan, you're recognized now for 5 minutes.
Thank you, Mr. Chairman. I have an amendment to the amendment in the nature of a substitute. Mr. Chairman, I have a common sense, good government amendment today that is important effort to stop wasteful and inefficient government spending in our health care programs. My amendment would require the Health and Human Services Secretary to conduct a study on new and old programs affected by this legislation to determine if there is any program or if there is any program duplication. Under my amendment, the Secretary must write a report on the study within a year of enactment of this bill. After writing that report, the Secretary would be required to eliminate any duplicative programs within 6 months. I'm particularly concerned with the number of new government programs that are created in this bill. This legislation is adding at least 31 new federal programs, agencies, grant programs, commissions, and mandates. With our nation experiencing record levels of debt, we need to be taking a hard look at waste and duplication on our government programs, especially when we are adding to them as this bill does. Also, with the CBO stating yesterday that this legislation will increase, not reduce, public spending on health care, we need to find taxpayer savings where we can. Just this week, it was reported that our budget deficit has already topped $1 trillion for the year and was on pace to grow to nearly $2 trillion by the fall. I think we can all agree that inefficiency, duplication, and wasteful spending are having devastating consequences for the fiscal health of our country. My amendment would help stop any wasteful or duplicative spending in this legislation. I believe that if we are all going to keep putting new spending and programs on the table, then we absolutely must have a mechanism to take old things off. My amendment provides the mechanism to do just that. Again, all my common sense amendment does is require a simple study on duplication of federal programs in this bill and allow the Secretary to take action on inefficient programs. I think everyone can agree to this, especially in light of the deficits we are facing in this country. And I yield back.
Chairman yields back his time.
Chairman, I withdraw my reservation.
The chair recognizes himself on the amendment. I am certainly sympathetic to what you're suggesting, that we make wise investments and not have duplicative efforts. But I'm worried about this amendment. The underlying bill requires the Secretary to develop a national prevention and wellness strategy, which I think would address your concern. That strategy requires the Secretary to inventory current prevention and wellness activities. It requires her to identify specific national goals and objectives and set priorities for future initiatives. The Secretary must also develop a plan for addressing these priorities, taking into account unanswered research questions and unmet prevention and wellness needs. And this report is to be submitted to Congress no later than 1 year after enactment of this provision. What differs is your amendment, which would require a study, which we also have, but then authorizes the Secretary to terminate programs as she deems appropriate without further action by the Congress. And I feel that the Congress ought to be able to use its own judgment before programs that we've authorized are terminated by anybody in the executive branch. I'm ready to terminate any program that's unnecessary and redundant and not cost effective, but I want the Congress to do it. I don't think it's appropriate to delegate that authority to the Secretary, and for that reason I would oppose the amendment. Mr. Barton.
Mr. Chairman, I rise in support of the Sullivan Amendment. We thought this was the single most innocuous good government amendment that we could offer in good faith to show we were going to try to work to improve the bill without destroying any of the underlying principles that the majority is embedded in it. This amendment's fairly simple. It says that the Secretary of Health and Human Services, who by the way is appointed by President Obama, within a year has to look at all the new programs in this division, Division A of the bill. So we're trying to stay within the scope of the procedure the chairman has organized, and send a report to the Congress. And then if in that study the Secretary determines that some of the programs are duplicative, and we even changed this a little bit, we said to the maximum extent appropriate, terminate other federal programs within this division. So we even gave a little leeway there. If you look at your underlying bill and you create a brand new commissioner who can terminate people's individual health insurance without any congressional act, I would think you could accept that a HHS secretary under this division of your new programs, your new bill, could, to some extent, terminate duplicative grant programs. Duplicative. So I would, you know, especially to my blue dog friends who are trying to do a little cost containment in the bill, this doesn't guarantee cost containment, but it at least directs the secretary and gives the secretary the authority, if you have duplicative programs under this division, to try to save some money. I think it's an innocuous amendment and could be unanimously supported.
Gentlemen, yield to me.
Sure.
Well, it just points out that both sides have now misjudged the acceptability of their respective amendments. First of all, you made a statement that I don't think is accurate. We don't give the authority to the secretary to terminate anybody's insurance whatsoever. But this amendment...
you give the commissioner, you create a new health commissioner that has that authority.
This amendment, I'm not sure that that's accurate. I doubt it, but we could look at that.
Well, we can check it. It's factual.
Because I don't think we ought to give the secretary this kind of power, any secretary. And you pointed out the secretary at the present time has been appointed by President Obama. If you were willing to say that there would not, the secretary would not have the ability to terminate the programs, but ask Congress to terminate them, I'd have no problem with them. I don't think the amendment's even necessary because we have that in our underlying bill. But what bothers me and why I can't support this amendment is authorizing the secretary, even using her best judgment, to replace the judgment of members of Congress that authorized the program to terminate these various efforts.
Well,
her recommendation would carry a great deal of weight, but I don't think Congress ought to give that kind of authorization to the executive branch.
Reclaiming my time, Mr. Chairman, I appreciate that, but then we have a fundamental difference of opinion about separation of powers under the Constitution. The Congress legislates, the executive branch administers. What you're saying is you don't trust President Obama's own appointees to administer the programs that you put into place. You
legislate.
You want to micromanage. I mean, secretaries have the authority right now to terminate programs, and presidents have the authority even when Congress appropriates, if not to spend those funds if they don't agree with the intent of the Congress. So we're just trying to prevent duplicative programs. You know, this is a massive change of the health care system as we know it, and we thought this amendment was fairly straightforward. If inadvertently, let's give you the benefit of the doubt that you're not intending to create duplicative programs. If just inadvertently you give some explicit authority to this secretary to pick and choose and try to eliminate duplication. I don't think that's partisan. I think that's good management and good sense, but obviously we have a difference of opinion. So I would support the Sullivan Amendment and yield back.
Further discussion on the Sullivan Amendment? Mr. Shadegg.
Mr. Chairman, I'll be brief, but I simply want to raise the issue that I think Mr. Barton just raised, which is what authority there is to do away with plans and whether the commissioner has the authority to do so. I believe at page 16, beginning with line 20, grace period for current employment-based health plans, the bill by its language says that a plan can exist, a current plan, a health care plan for employer-provided health care may continue to exist for 5 years without meeting the requirements, the minimum requirements prescribed by the Health Care Benefits Advisory Committee for that 5-year period. At the end of that 5-year period, if it does not meet those requirements, it goes away. So as I understand it, the commissioner does have the authority to wipe out all existing plans at that point in time. And I believe that's what Mr. Barton was referring to. It's not something we need to go into now. We can go into it at a later point. Indeed, I'd be happy to ask for clarification from counsel at a later point in time. With that, I'll be happy to yield to Mr. Rogers of Michigan.
Thank you. And Mr. Shadegg and I think others, you point to the huge problem of dropping a 1,200-page bill where I think nobody's read the bill clearly. And maybe, Mr. Chairman, you haven't got to page 44. under Section B of that page, suspension of enrollment of individuals under such plan after the date of Commissioner notifies the entity of determination. So not only can you do a whole plan, which is in a later section in the bill, under this page, they can actually go to an individual and throw you off a plan. So it is clearly under the bill of which you have written that they can throw people off the plan, and you've given not only the Secretary, but this new Health Choices Commissioner. And that's what I think is so dangerous. And if you're concerned that they can do that, Mr. Chairman, it sounded like you were, maybe we ought to postpone this hearing and actually allow us to go through this bill and find those instances where you have empowered the federal government to throw individuals off their bill. And by the way, there's nothing in here that even says you have to notify them. It's pretty dangerous stuff, and I'm going to agree with Chairman Waxman that this is a concern, and we ought to work together to get it out of the bill.
Will the gentleman yield? Will the gentleman yield?
It's my time, and I'd be happy to yield to the gentleman from Oregon.
I just want to follow up and maybe enter into a colloquy with my colleague from Michigan, because are you saying that this unelected commissioner can do something to throw people out of their insurance plans without notification, perhaps? Is that what you were saying?
Under the bill that is written and has been presented to us yesterday, that is exactly what they can do. The suspension of enrollment of individuals under any plan after the date the commissioner notifies the entity, they can do it.
So they can do that, and the amendment before us simply says if they're duplicative grant programs, that the Secretary should try and eliminate that duplication, right?
That would be correct, sir.
But we're hearing that shouldn't be allowed. That's too much of a delegation of authority. But yet in the bill they can kick people off a plan without. I mean,
and not only do they kick them off the plan, sir, but under the second paragraph down, they can also suspend payment to the entity under health insurance without notification.
Gentlemen, yield to me. Mr. Shadid.
I'd be happy to yield to the chairman.
I think that what's being raised is a red herring, and let me tell you why. We allow the commission to look at the insurance plans to be sure that they meet the requirements under the law that this bill would promote. For example, if an insurance plan were discriminating against people based on pre-existing condition and they refuse to make a change in that plan would not be qualified to be operated. That is the power that's given, not to say to individuals that they can no longer get insurance. No one would be for that. But we're not talking about that section of the bill. We're talking about a different section of the bill.
The chairman has pretty much unlimited time, reclaiming what limited time I have left, and having in the past been criticized for consuming all of the time I'm given. Let me simply just say that I appreciate the gentleman's explanation, but that does not appear to be the words of the bill. The words of the bill seem to indicate that plans must go out of existence by a ruling of the commissioner at a certain point in time, and that seems to be in the commissioner's discretion. And the language raised by Mr. Rogers makes it pretty clear, at least from the wording of the bill. And all we can do, Mr. Chairman, given the circumstances of not having been in the process of drafting this bill, is to read from the bill. And I think the gentleman from Michigan has adequately pointed out that this allows the suspension of the enrollment of an individual under such plan. That's the wording of page 44, line 16 and 17. And I'd be happy to yield to Mr. Rogers.
Thank you, Mr. Chairman. And not only is it under the individual, but they've also done this with later on in the bill, and I don't have the section before me that says the Secretary can do it for an entire plan and an entire company with consultation with the Health Choices Commissioner. They can actually eliminate whole plans through the company, as well as you stated out, individuals.
I appreciate
gentleman's time is
appreciate the gentleman for his indulgence.
Mr. Chairman.
Mr. Pallone.
I yield.
You seek recognition.
Seek recognition. Strike the list.
Would you yield to me?
And yield.
Chairman does not have unlimited time. The chairman has to abide by the same rules as everyone else. Let me just say that I disagree with the strained reading that is being offered to a section of the bill that is being used for a different interpretation than what I think the clear reading of it entails. Which one is it?
These are the remedies that they
The remedies described in the paragraph with respect to a qualified health benefit offered by a qualified health benefit plan is they can have civil money penalties, or they can suspend the enrollment of individuals under such a plan after the date the Commissioner notifies the entity of a determination that, under paragraph 1 that the plan does not qualify. That is a way to enforce the requirement that the plans be qualified. But let me just say, even if you read it differently, the issue before us, and I'll review your interpretation because I wouldn't want to give Secretary or anyone in government such enormous power, but the amendment that's pending before us by Mr. Sullivan gives the Secretary the power to terminate authorized programs that may already be appropriate, where there may be even appropriations of funds. I think Congress would want to have strong recommendations to terminate those programs. We don't disagree about that. What we disagree about in this instance, in the Sullivan Amendment, is whether the Secretary should have that power. And we may disagree on that, but I just want to make clear my reason for opposition.
Would the gentleman briefly,
Yes,
the Sullivan Amendment only gives the Secretary the authority to eliminate duplicative programs established by this division. If it's an existing program from a prior Congress that's not newly created in this law, this amendment does not apply.
Gentleman from New Jersey, I would ask counsel, if you would permit.
Yeah,
what would the Secretary, under the Sullivan Amendment, be able to terminate if she found it was duplicative in her opinion? Wouldn't that apply to programs within the Public Health Service Act that address prevention?
It requires the Secretary to review both the new programs and the existing programs, and then authorize the Secretary to terminate such other federal grant programs, which I would understand to be not the programs in this division, but the programs that are currently in existence.
In any case, Mr. Chairman, if I could reclaim my time, I think there's, between what counsel just read and other provisions of the bill where the Secretary is supposed to report back to us about these various programs, I think there's ample opportunity in the legislation now to have either her or the Congress subsequently terminate duplicative programs. So I just don't see the need for the Sullivan Amendment. I just think it's unnecessary given what the underlying bill says. But I'll yield to the chairman.
Well, I have nothing further to add. Gentleman, you'll back his time?
Yes.
Any further discussion? If not, we'll proceed to a vote on the Sullivan Amendment. All those in favor of the amendment say aye. Aye. Opposed, no. No.
Recorded vote, please.
Gentleman asked for a recorded vote. Let's proceed to a recorded vote.
Mr. Waxman?
No.
Mr. Waxman votes no. Mr. Dingell? Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Rush? Mr. Rush votes no. Ms. Eshoo? Ms. Eshoo votes no. Mr. Stupak? Mr. Stupak votes aye. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette votes no. Mrs. Capps? Mrs. Capps votes no. Mr. Doyle? Mr. Doyle votes no. Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky votes no. Mr. Gonzalez? Mr. Gonzalez votes no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Weiner? Mr. Weiner votes no. Mr. Matheson. Mr. Matheson votes aye. Mr. Butterfield. Mr. Melanson. Mr. Melanson, aye. Mr. Barrow. Mr. Barrow votes aye. Mr. Hill. Mr. Hill votes aye. Ms. Matsui. Ms. Matsui votes no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy, no. Mr. Space. Mr. Space votes aye. Mr. McNerney. Mr. McNerney votes no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Braley votes no. Mr. Welch. Mr. Welch votes no. Mr. Barton. Mr. Barton, aye. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Upton, aye. Mr. Stearns. Mr. Deal. Mr. Deal votes aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shattuck. Mr. Shattuck, aye. Mr. Blunt. Mr. Boyer. Mr. Boyer votes aye. Mr. Radonovich. Mr. Radonovich, aye.
Mr. Gordon.
Mr. Pitts. Mr. Pitts, aye. Ms. Bono Mack. Ms. Bono Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick votes aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy of Pennsylvania. Mr. Murphy, aye. Mr. Burgess.
Lose this amendment. We're either
Mr. Burgess, aye.
Ross or we're going to lose Gordon or Mr. Dingle won't show.
Ms. Blackburn. Ms. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Markey. Mr. Markey votes no. Mr. Dingle. Mr. Dingle votes no. Mr. Ross. Mr. Butterfield. Mr. Butterfield votes no. No. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Ross. Mr. Ross, aye.
Have all members responded to the call of the roll? Does any member wish to change his or her vote? If not, the clerk will tally the vote. Just a minute.
Mr. Chairman? How am I recorded? How am I recorded?
Mr. Boyer? Mr. Boyer is recorded as voting aye.
As an aye?
Yes, sir.
All right, thank you.
Mr. Stearns? Mr. Stearns
Mr.
votes
Stearns
aye.
votes aye.
Anyone else wish to be recognized? If not, the clerk will tally the roll. Yeah, I think so too.
On that vote, Mr. Chairman, the yeas were 29, the nays were 27.
29 to 27, the amendment's adopted.
Before I vote.
Now we will recognize members for further amendments.
I have an amendment at the desk,
Well, just-
and I'd like to
We're
ask
trying to
unanimous consent to,
If the gentleman would withhold, we are trying to clear a number of amendments together.
I know I was going to ask unanimous consent to do it in block between Baldwin number 1, Gordon 002, and Green 002.
Mr. Chairman, I reserve point of order.
Well, the gentleman's requesting this, and let's just be sure we have clearance.
Unanimous
Republican
consent.
side. Yeah.
You know, Burgess, I think that's the first time in 3 years we've won anything.
Look at this. Before this thing. You should tell the people in your office.
If the gentleman from Texas would modify his unanimous consent to do the Green and the Baldwin amendment.
We have no objection
The
to that.
Republican side has no objection to that.
Okay, so
Green 002 and
Baldwin 01 and Green 02?
that.
We'll accept those in block.
Okay.
Without objection,
Modify
those two
my-
amendments will be considered in block. Without objection, both amendments will be considered as read. And the gentleman from Texas is recognized for 5 minutes to explain his amendment.
Thank you, Mr. Chairman, and I'll be as brief as I can. And I know Ms. Baldwin will want to discuss her amendment. I have an amendment that I've worked on for behavioral health training grants, not only myself, but Mr. Murphy of Pennsylvania.
If the gentleman will yield, we'll accept both amendments. Pardon? Voice vote. We'll accept them.
Okay.
We want to end up on a positive note.
I accept that and withdraw my.
We'll accept Ms. Baldwin's amendment and your amendment to show that we're good guys. And let's go vote and come back Monday and start over.
Mr. Greenwood,
I'm going to make sure the good guys in the record, though, before I do. No.
We're trying to be helpful here. Now, I can slow this thing down.
Hey, just quick, if Mr. Green would yield there, on the Baldwin amendment, we're still working on some clarification language. I think we all agree in principle on what we're doing with the Baldwin amendment. We just want some clarification language on possible euthanasia language in here on this amendment. I'd yield to Ms. Baldwin if she wanted to just clarify that. I'm willing to go voice vote, but just as long as we have this understanding.
Absolutely. Mr. Stupak and I have had a significant discussion about an amendment to the Baldwin amendment. I think we're in agreement, and as we move forward, we can incorporate that. But I know we're trying to get this through quickly on a voice vote. So,
This is unanimous.
I would ask unanimous consent to insert on page 3, line 5, the language, any grant awarded under this act shall not go to any government or non-government organization that promotes suicide, assisted suicide, or the active hastening of death. Nothing in the previous clause shall be construed to prohibit palliative or hospice care.
Without objection, that will be the order.
Reserving the right to object.
The gentleman is recognized on his reservation.
Well, I'm just curious. I just barely heard what she wanted unanimous consent for, and it related to suicide, right?
There was some.
It's a right to life. It's actually acceptable to the right to life community, what she just said.
I understand. I just like clarification on it. I actually come from a state that twice has voted to allow assisted suicide, and I'm not an advocate of that, but I'm trying to figure out the implications of what you're asking for in the legislation on my state of Oregon.
The gentleman is recognized if he'll yield to.
Will the gentleman yield?
Absolutely, of course.
And I apologize for my brevity. I was trying to get us out quickly, but I'm happy to explain. Mr. Stupak raised with me, I've worked on this amendment with Mr. Burgess, a concern that the public information program and outreach that's going to go on in the amendment, that the grants to do this not be made available to those organizations that are sort of promoting assisted suicide,
Understood.
but rather are conducted by governmental or non-governmental organizations that are there to provide information about all the options available. What happens, I never actually explained the original amendment. What happens, is that in way too many cases in America, people experience end-of-life medical care that is misaligned or absolutely contrary to their wishes. And this is an amendment that is is there to help people understand what their options and express those in advance directives and other vehicles.
And I have no problem with that. I'd just like to know the implications of this amendment. For example, if a doctor...
Does the gentleman object?
That's the only way I can get any discussion on this to get answers. We are in a markup here. And this stuff's flying.
We are relying on both the Republican and the Democratic staff to discuss these things. Do you object?
Yes, I object.
The gentleman objects.
Would the gentleman, before he...
Mr. Chairman.
This is not something that would be objectionable.
Well, I'd like to know that. I'd like to know the implications. You got a 1,000-page bill here with all these amendments flying. We got a rush to vote. And I can't even find out, are you cutting off funds to agencies in my state that may have nothing to do with this, only by some connection could get harmed? That's all I'm asking for. So, you get cut off on the floor, you get cut off in the Rules Committee, you get cut off here.
If the gentleman...
It'd be nice to legislate...
Let's ask whether that's the intent of the amendment, and let's...
There's no cutting off of funds. This amendment creates a new outreach and information clearinghouse to help promote better communication about end-of-life options, advanced directives, other legal tools, and where people can express their wishes for end-of-life care. And I'd be happy to yield to Dr. Burgess, with whom I worked very hard on this amendment.
I thank the gentleman for the recognition. This is a concept was to allow for end-of-life planning before you got to that point in the care of a patient, and really this was only to deal with the ability to establish grants between the recipient of the care and the secretary. And it would not involve the states.
Would the gentleman yield to?
Yes.
Ranking? Isn't it true though that the language that Mr. Stupak and Mrs. Baldwin agreed with would be considered to be pro-life language? In other words, it would, if you are a pro-life member, the unanimous consent request improves the bill in that respect. Is that not a true statement?
Well, of course, I am a pro-life member, and your statement is correct.
Okay, so I would ask my friend from Oregon to not object to this. This actually improves the bill. If there's something,
well, if the gentleman's yielding,
if you allow it, you have the time. Doesn't this promote what the people in Oregon voted for, to provide information about end-of-life alternatives? It doesn't conflict, as I understand it, with your
this is all I've been asking.
Policy. I think that's a legitimate.
It is just to find out what in the devil it does or doesn't do.
Okay.
And what I'm told is to basically be quiet, don't ask questions, we got to go. It's been agreed to by others who apparently have negotiated it. That's great. I'd just like to know, from my state's perspective, who wins, who loses, and then I can make an informed decision.
Does the gentlelady who's offering the amendment have an answer?
And I take you all at your word. I'm just trying to get answers.
The entire intent of the amendment is to have better communication
Sure.
on end-of-life issues.
And I'm an advocate for that.
We're all going to die, but we hate talking about it. And in fact, the medical profession has not been great about communicating options, especially when these issues are not imminent. We want to, through a clearinghouse of information, let people start thinking about what type of medical interventions one would want, and express those where possible in things like advanced directives and other legal tools that are available.
And
that's what this amendment achieves.
Gentleman withdraws objection to the unanimous consent request.
I will withdraw my objection.
We have less than 3 minutes on the floor, so let us take the vote if the gentleman would permit, so we can.
Mr. Chairman, give me 30 seconds.
30 seconds.
Let me just say that I wholeheartedly support the gentlewoman's amendment. I have a bill pending that addresses the same issue. And when we talk about bending the growth curve in regard to end-of-life care, which a lot of people don't want, but you have to give it because you don't know, I think this is a very important amendment. I fully support it, and I yield back.
The unanimous consent request to make the change is now agreed to. The vote now occurs on the two amendments in block. All those in favor of the Green and Baldwin amendments say aye. Aye. Opposed, no. The ayes have it, and the amendments are agreed to. We will recess, and I don't think we'll be able to return, given the fact there are 18 votes on the House floor, and given the time that we had agreed to end today. So we will recess until Monday at 4 p.m.
Yeah, we're off to an auspicious